Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the series around the Globular Global. This audio podcast is part of a Lunar Insurgence. This audio podcast is part of a Skeletal Robotics. This audio podcast is part of a Storm Robotics production. In this audio podcast, a little bit around the decision, the decision or the sort of process in around to transfuse. So, the causes of preventable transfusion-associated complications are numerous and often occur because adherence to disease management and transfusion best practices are inconsistent. There is presently, or has been presently no unified system that provides ongoing statewide or sort of underpinning sort of education to healthcare service users and to healthcare service users, but also to sort of updates in around sort of transfusion transfusion practices, for example, to healthcare service providers. So clinical decisions are still challenged or questioned relating or regarding patients sort of patients around patients sort of understanding and professionals having knowledge about management guidelines, personal experiences with transfusion and attitudes and beliefs. So laboratory specialists and laboratory and around laboratory sort of and laboratory sort of procedures and research have advanced, especially regarding sort of serology around serology, for example, around the human leukocyte antigen or HLA and tissue typing and cross matching. Several authors have also indicate failing tissue oxygenation would be ideal to guide the need or requirement for transfusion, but this has not proved effective, reproducible, or sensitive to tissue hypoxia. The clinical importance of red blood cell storage lesion is still lacking. Red blood cells can be filtered, washed, frozen, or irradiated for specific indications. Donor screening and testing have dramatically reduced infectious risk in the developed world, making transfusions more broadly accessible, but infection remains a hazard in developing countries. So, for example, where for example 13 million units of blood are sort of in sort of historically in amongst the in around the literature had informed that blood units of blood are not tested for human immunodeficiency virus or hepatitis virus, and despite serious immunological and non-immunological complications, RBTs or red blood cell transfusions still hold a therapeutic index that exceeds that of pharmacological interventions. That draws this audio podcast to a close. This audio podcast as part of a Globular Global. This audio podcast as part of a Lunar Insurgence. This audio podcast as part of a Skeletal Robotics, and this audio podcast as part of a Storm Robotics production.